Hi, my name is Emily Stallings and I'm 18 years old. If I were to ask you to list some common food allergies, what would you list? You would more than likely or probably list allergies such as peanut allergies or intolerances such as lactose intolerances. However, more recently, you may have been wondering or noticed more people in your life going gluten-free, or maybe you've noticed some more gluten-free items in the stores and wondered why. Why are so many people going gluten-free? Why is gluten-free becoming so popular? Well, this can be due to many reasons, of course. Some reasons could be, some people just want to go on a gluten-free diet to lose weight, when others want to go gluten-free, or not because they want to, but because they have to, because they have an actual medical condition. So some people get diagnosed with celiac disease and other people are gluten intolerant. So celiac disease is an immune reaction to eating gluten, and gluten is wheat, rye, or barley. And over time, inflammation and damage to the small intestine is caused, which leads to many medical complications. It also prevents absorption of nutrients in the small intestine. Some common symptoms that come with celiac disease is anemia, anxiety, bloating or gas, constipation, delayed growth in children, depression, diarrhea, discolored teeth, fatigue or tiredness, headaches or migraines, infertility, irritability, itchy skin rashes, joint pain, liver disease, pale mouth sores, poor weight gain, thin bones, tingling or numbness. Now, celiac disease can sometimes be very difficult to diagnose just due to the wide variety of symptoms that it has. So, for example, one patient could have diarrhea and abdominal pain, while another patient just has irritability or depression. Now, that doesn't mean that just because you're struggling with irritability or depression, that doesn't necessarily mean you have celiac disease. That just is some of the symptoms that come with that disease. So, what happens when you get diagnosed with celiac disease? So it's pretty easy to avoid once you get used to it. So you basically just avoid and stay on a very, very, very strict gluten-free diet. And this might take a while for your body to get used to and to heal from. So anywhere from 6 to 8 months to a year to even more. So some people will develop celiac disease very early in their life, and others will develop it far into their adulthood. So on the other hand, there is gluten intolerance. So what is gluten intolerance? It's also called non-celiac gluten sensitivity. Notice it said non-celiac. So this is, I guess you could consider it less severe. So with non-celiac gluten sensitivity, for example, you send off a celiac blood test because you're having the symptoms of the celiac disease, but the blood test comes back negative for celiac disease, but you still feel terrible and you're having all the symptoms that celiac disease has. You could just be gluten intolerant. So the difference is with celiac disease, when gluten is ingested, his or her immune system will attack against its own body tissues. However, with gluten intolerance, when gluten is ingested, his or her body will react by causing short-term pain and bloating. It usually has no long-term harm to the body. So I can definitely confirm the gluten intolerance issues that come with it. I have struggled with gluten intolerance pretty much my whole life. When I was in the 4th grade, I started having a lot of trouble eating and having an appetite, and just always, my stomach was always hurting. I was losing a bunch of weight, and I was starting to just feel awful because my body wasn't, digesting the food correctly, and it was just a horrible little moment there. We sent off a celiac test, and it came back negative, and we were like, well, I don't have celiac, but I have all the symptoms of celiac. What's wrong? And a friend of ours suggested going gluten-free due to being gluten intolerant. So we highly considered it and prayed about it and tried it, and it helped. It very much helped. It took me 6 to 8 months before anything started getting better, and about around a year before I started gaining any weight back. So it did take some patience to get used to it and for it to actually start benefiting my body. But I hope that this has helped your understanding or bettered your understanding of celiac disease and gluten intolerance. Thank you.